Hi class, I wanted to make this video showing you how to do a biopsy punch tray. So sometimes patients come in and they have a suspicious growth that the doctor needs to biopsy and send off to pathology for analysis. And so it needs to be removed from the patient. And we have here our tray. So we have a fenestrated drape, and remember this fenestrated drape has a hole in it for the doctor to create a sterile field over the patient's suspicious growth, with the growth peeking through the window. And then we have a 5 ml syringe, and there's an 18 gauge needle, a 25 gauge needle. So the 18 gauge needle is used to drop the lidocaine because we have to numb the growth before we can punch it. And then we have here, the doctor will switch out the needles to put on a smaller needle so we don't injure or hurt the patient as much. And we have here, this is also the biopsy punch. So it basically punches out the growth. And then we can put it in this formalin, this buffered formalin, and send it off to the lab for analysis. So when the doctor first comes in to the room, you need to have all your supplies set up and maybe even a chuck set out for the patient. So the chuck will absorb blood if there's any blood loss. And you can even pull out the exam table so the patient can lie down comfortably. And then we have our tray set up, and we have more supplies off to the side. So we have sterile surgical gloves, there's the formalin, there's the lidocaine, and we have some alcohol and some iodine. So when you have the patient lying down, right, you want to rub the iodine onto their lesion, right, to cleanse the area. And while you're doing that, the doctor's putting on the surgical gloves that are sterile. And then he'll come over to his tray. And so since his hands are sterile, he can now touch the tray. And he will assemble the syringe and 18 gauge needle. And during this time, right, you are wiping the lidocaine off the top of it with alcohol, right? And then you hold it upside down for the doctor so he can know what he's drawing up is correct. He needs to see the label. And then he will switch out the needle. He'll switch out the 18 gauge for a smaller gauge. And then he'll inject the lesion. And then we need to wait several minutes to make sure that the patient gets numb. He'll also, wipe off the iodine area before he injects, because you don't want that iodine going into their body. And he'll also put the sterile field over them, the fenestrated drape. And then what he'll do is he'll take the biopsy punch and remove the lesion. And while he's doing that, you want to hold the buffered formalin open, right? So you're going to open it up so he can put the lesion inside. And then you'll close the lid and send this off to the lab with the patient's label on it. And at that point, the doctor might also put in a stitch into the patient. It just depends on how big the lesion is. Or he could potentially cauterize it to stop the bleeding as well. So he'll give you some more directions on how he wants to do post-op care. And he'll also instruct you if any dressings are to be put on the patient and what kind. And that sort of wraps it up